far?
Yeah, I think last week we assessed the government response and containment at 80%.
Okay.
And later on, the president announced the lifting of the lockdown. So we are still assessing to see whether we are stagnated or we will still maintain the 80 or moving forward additional marks for government. We are yet to determine that based on certain indicators. But by and large, I think Ghana is doing well. The government has gotten largely support from the public, the media, the civil society, some traditional leadership. There are already gray areas which we will continue to research, advocate, and also educate so that we can all complement government mission, because we are all in the same boat. If we sit back, then we can all have the effect as we are facing.
So 80% you give government for its handling of coronavirus. 80%, that's an A+, I believe. What is it that stood out? On what basis do you give government that sort of assessment?
Yes, at that point in time, if you notice, in February we gave government 30%. In March we gave government 40%, and it moved to 60%. And in April we gave government 80% as at last week, before the lifting of the lockdown. Now, during the lockdown, when we assessed, we got to know that almost all the indicators from WHO and the Ghana strategic objectives were adhered to, except that we're having implementation challenges.
Okay.
For example, the issue of sharing of food and relief items to people in the lockdown was not managed well, and therefore they didn't get all the marks there. The issue of converting local, the content of education into all the different 9 languages, as at March, we had done little. But as at last week, we largely had almost all the official languages being used in Ghana. And the lockdown was a plus, and then the social distancing was being promoted, and the other protocols were also being promoted. So that was the reason why we were almost at the peak of moving to maybe 95 or 90 when the government called
the lockdown. Okay. It looks to me as though... Yes, please go ahead.
We are a bit stagnated, but we do hope that we haven't lost, and that's why we wrote the letter to the president. I know his secretary has received, because they also use social media to communicate to us. So we are taking advantage of social media to communicate, and I know by now.
I will come to the letter. I'll come to the letter shortly after just this one or two questions. And the question is, a lot of people have raised concerns about lifting of the lockdown. Most of my texters, viewers who are texting us, are raising concerns about lifting of the lockdown. They say, so they make a very, if you like, straightforward sort of analysis and say, when we had a few cases, we were in lockdown. And when the numbers are spiking, we have taken off the lockdown. What's your opinion about the timing within which we have lifted the lockdown? Is it a good thing? Is it a bad thing? Where do you stand?
Yeah, for the lifting of the lockdown, we needed to prepare adequately before lifting the partial lockdown. And we also needed to progressively lock down other regions. But it didn't happen. And from our assessment, what government could have done is that they could have put in place systems which we call the 6-in-1 strategy, properly we do recognize that we also have done that with research. we have conducted research just within the last 3 days, and guess what? Over 70% of the respondents, that's 349, who answered the question whether they were happy about the lockdown, they said no. The lockdown was not, the lifting of the lockdown was not necessary. And it's part of the communique we have sent to the president. Even though he has done it, but he needs to strengthen the other 6 strategies that Ghana is using. Social distancing. We need to have an executive instrument. That's what we are proposing to ensure that the 6 in 1 are properly coordinated and enforced, just like using the executive instrument to give directives for the regions to be partially locked down. We think that using the EI can make an impact because we are social beings and we tend to behave differently when we relax our law enforcement.
Okay, so let's look at the feedback that you have. 3 of them, you put them together in 3 bullet points for the presidency. You indicate, first of all, that there is the need for Ghana to establish a national control program. And my question is, so far, we do have a certain, if I don't want to say strategy, but we've seen government, and you've yourselves called them 80%. So we've seen government putting in some efforts. Are you saying that there is a need to put these efforts or coordinate these efforts together in a particular document, or that there has to be a different strategy that all of us understand?
A control program simply means that the national response, regional and the district response that the government have established are not going to be there forever. But when they are submitting their report to the president, what will be the sustainability plan? And we have done that for the area of HIV, we have done that for malaria, we have done that for TB, we have done that for leprosy, and other burden disease areas. So it is just economically wise, and it's just public health and sociological point of view that let's create an institution that can continue to consolidate the gains that we'll be making in the fight against coronavirus. And don't forget that coronavirus is going to be with us now. It is something we cannot do away with in our system, and therefore you will need to have an institutionalized system. So we have a national control program, we have a national manager, we have regional manager, and we are going to have district managers.
Isn't that going to, create, if you like, expenditure that perhaps we're not ready for?
No, health issues cannot be compromised. If we want to protect every Ghanaian, as mandated by the Constitution, then money doesn't come in. As the president said, we can fix the economy, but we cannot bring back a life lost. And therefore, national control programs over the years have had a lot of support and even funding. So that's why we have HIV funding, we have malaria funding, we have TB funding. So government can create, and as we all know, we only need to create a national emergency fund. And that emergency fund can be used to support some of these things as an emergency situation. You notice that over the last 2 months, when we didn't have funding, because last year we didn't budget in our national budget for national emergency, we were found wanting until when the president was able to mobilize some few resources.
Okay. So the next 2 things on your...
So, as a country, we need to be...
Right. I was just going to go to the next two recommendations you're making to government. You're also calling for, you've spoken about this already, that the president should pass another executive instrument on the 6-in-1 strategy. Well, the 6-in-1 strategy, which is hand hygiene, using hand sanitizers, cough etiquette, clean everyday environment, and face mask. I mean, exactly how do you expect something like this to be enforced if it's passed, if the president passes something like this as an executive instrument?
if you notice when the government advisor on health, Dr. Nsiansari, on your PM Express yesterday, most of the issue he was lamenting or he was proposing were issues of social and psychological concern. And so you need to deal with sociological and social and psychological issues in health very, very proactively, because human beings cannot be predicted. Once you lift the lockdown, people will move. Once you promote social distances, people will behave differently. Let me give you a typical example. We have collected information, people who decide to use the mask. In 30 minutes says that, no, this is difficult, I'm already sweating. You see, you need to intensify the myth surrounding wearing the mask and let the person know that maybe after 1 hour or after a day, you get used to it. Otherwise, people will not patronize it. So this is sociological. Social distancing. The people already have that free life over the last years of themselves, and they are free to move, they are free to come together. So if you tell people to social distance, they get sick sociologically. And therefore, you need to provide social intervention, which you will need social workers, you need sociologists, you need psychologists to be able to do that. And therefore, we are promoting and advising government that they should strengthen and provide logistics for the 6-in-1 strategy. One, he has lifted the lockdown partially.
Okay, let's look at your final recommendation. You call for strengthening of the mental health authority. You say that could greatly reverse the adverse effects of various degrees of mental illness and stigmatization. When you say strengthening of the mental health authority, exactly what do you mean?
The mental health authority by law is supposed to provide psychosocial services to you and I anytime we are in crisis or in our normal period. And if you look at the WHO definition of mental health, the issue of moral, social, and spiritual is very highlighted. Now, we have asked all churches to close down. We have asked all schools to close down. We have asked all our traditional institutions to close down. We have asked all social gatherings, including funeral and cultural celebrations, close down. You will need a specialist that can provide an interlocking information that can reduce anxiety among the population, that can reduce stigma of the infected, the suspected, the affected, and the communities affected by the coronavirus. This is not a small job. It is not only public health that can do that. It is a comprehensive social medicine that can do that. And government have flouted the rules of not involving psychologists proactively, mental health officers proactively, social workers proactively. And that is why we are doing that. And nonetheless, our research confirms that more than 55% of Ghanaians are feeling anxious. And anxiety can lead to depression. Depression can lead to complications. So as a country, we are making this proposal to the president to look at it seriously and see how he can bring on board the mental health authority to provide their technical role.
All right. Dr. Bernaku, I say a very big thanks to you. I just do have a message here, and I'll wrap up our conversation with the message that came in. It's coming from Alex. Alex says, the NGOs score government 80%. The NGOs score government 80%, but their research shows that many people are not happy about lifting of the ban. How did they arrive at that percentage? But they did this before the lockdown was lifted. Before the lockdown, the imposition of the lockdown itself was part of how they scored government 80%. Dr. Bernaku, thank you so much for your time this afternoon. I believe I've answered the question right. Dr. Bernaku is the chairman of the Coalition of NGOs in Health. there. Now, with the outbreak of coronavirus, frontline workers at 6. Well, we're supposed to go on a break, I believe. All right, let's do that now. We'll be right back. When we come back, I'll take you to Anglo and how the hospitals are lacking PPEs. We'll also be talking to the police service here, assessing the lockdown duties that have passed so far. What has been the outcomes, and what are the